Welcome to Preparing to Become Parents for Voigtlander Women's Hospital, Michigan Medicine. Preparing for the baby, arriving at the hospital, and labor. Now let's talk about preparing for the baby. When you're experiencing contractions and ready to come in, make sure you call triage and let them know you are coming. If you're already a patient at Michigan Medicine, there's no pre-registration required. Many of you already have the triage number saved in your phone, but make sure that number is saved for any emergency you may have. The number is on the screen now. Triage is available 24 hours a day, 7 days a week. If you want a tour of the birth center, there are birth center tours available. To schedule, please call the number you see on the screen. If you prefer to view this tour virtually, as well as read about more information, see the website here. During one of your prenatal visits, you will be screened for a bacteria called Group B strep. Group B strep is a bacteria that about 10 to 30% of women are carriers for. It only lives in the vagina, rectum, or bladder. It is not sexually transmitted. We recommend testing for it between 35 to 37 weeks at your provider's appointment. If positive for Group B strep, we recommend you receive antibiotics during labor. It is not harmful to you, but some babies can get a very serious full body infection from this during birth. If you are negative, there is nothing to do after testing. Whooping cough, or pertussis, is a disease that makes it difficult for a baby to breathe and can be life-threatening. Babies cannot be vaccinated against pertussis until 2 months of age, so make sure family and friends check with their primary care providers if they have received the Tdap vaccine, which is not the same as the TD or tetanus booster. The Tdap vaccine is something recommended for every pregnancy during your 3rd trimester and passes some immunity to baby in utero. It is recommended for anyone who has not had this vaccine who will be in close contact with the baby. For maternity leave, bring any paperwork you may have to a prenatal visit to be filled out. Employers are all different in what they offer, and there's no standard amount for time off. However, we recommend 6 weeks medical leave for a vaginal birth and 8 weeks medical leave for a cesarean birth. If you have any questions, discuss it with your employer or HR department. We can also write a letter with our recommendations. The Family Medical Leave Act, which only certain people are eligible for, provides unpaid leave for 12 weeks. For more information on this act, visit their website. Michigan Medicine recommends 12 weeks off after the birth of your baby to promote healing, bonding, and breastfeeding. Mount Buckle Up is a free program that teaches you how to install your car seat in your car and how to put baby in the car seat safely. They do these teachings at locations out in the community. It is recommended that you sign up for this service before coming into the hospital because the nurses on the floor are not allowed to teach you how to use the car seat as they are not professionally trained to do so. Call the number on the screen to make an appointment or visit the website at the link listed below. Call OB Triage if you're experiencing vaginal bleeding, leaking amniotic fluid, regular painful contractions that are increasing in intensity, or decreased fetal movement. For vaginal bleeding, you might be experiencing what is called bloody show, which is small amounts of reddish or pink-tinged mucus. This is normal during labor. Bloody show doesn't tell you when you're going into labor, it is just another piece of information that labor might be on its way. However, notify your provider right away if there's bright red bleeding or significant amounts of bleeding. It might be difficult to tell the difference between loss of fluid versus urination versus heavier vaginal discharge. Make note of the amount, color, odor, and when leaking or gushing first occurred. Wear a panty liner and monitor. If they are constantly wet or saturated, let us know and we will decide if you need to come in. Some women do leak urine, but if you are unsure, call and let us know and we will help you to evaluate. If you do start to feel contractions, jot down how often they are happening and how long they are coming from the start of one contraction to the start of the next contraction. This will tell you how far apart they are. Contraction pain is usually low down in the pelvis or top of the belly, but some women feel it in their back, similar to a backache. You might have been experiencing backaches throughout the pregnancy, which is pain that is usually constant and doesn't go away. Contraction pain, on the other hand, is more likely to come and go. For decreased fetal movement, pay attention during active periods that you have noticed are more common for your baby. For example, if your baby is most likely to move after dinner, but one day the baby is less active during this time, pay closer attention. Movement can be anything from hiccups to big kicks. It's normal for baby to have periods of sleep or rest, just like you and me. You will most probably experience consistent movement after 24 weeks. If you've had a baby before, you will sometimes experience movement at 16 to 20 weeks, but it may not be as consistent or reliable. If you are concerned for decreased fetal movement or can't remember the last time baby moved, lay down on your side somewhere quiet and pay attention to movements. If baby moves more than 5 times in an hour, then that's great. If baby moves less than 10 times in 2 hours, call triage. Now let's talk about what is true labor and what is false labor, or also known as Braxton Hicks contractions. With true labor, contractions are getting stronger and do not go away with position changes. But with false labor, contractions may be regular, but are typically irregular and do not increase in pain and are slow or disappear with position changes. Bloody show could be a sign of true labor, but there's usually no bloody show with false labor. Finally, with true labor, contractions feel menstrual-like with a possible backache, whereas with false labor, contractions are uncomfortable but are not painful. Remember, when it is time to come in, make sure you call triage to let them know you are coming. In terms of parking, park in the Mott structure across from the Mott building, or pull into the half-circle drive to access valet parking. It will be $5 per day for valet, or $2 per day in the structure. If urgent, use the valet services and let them know it is urgent. Security can put you in an express lane. Upon arrival to the hospital, go to the 9th floor OB triage. Do not go to the emergency department unless you've been instructed to do so. Here is what to expect when you arrive to the birth center. You will first arrive at OB triage. Then you will be admitted to the birth center into a labor and birth room. After 2 hours of recovery after birth, patients will move to a postpartum room, still on the 9th floor. You will be assigned a nurse. Do not be shy when sharing your birth preferences. Tell the team what your desires and hopes are for labor. Your baby will be monitored intermittently or continuously with fetal monitors during labor, depending on the stage and intervention. In terms of the people in the room with you, if you would like to have a child in the room with you, there must be an adult present in the room to be responsible for that child, but it has to be an adult other than your support person. Note that children under 16 years old cannot spend the night. If you have a cesarean birth, you can have one person in the operating room with you and 2 visitors in the recovery area. For pain management, we have many tools to support you, including medications and coping tools. Morphine takes the edge off contractions and can be very helpful early in labor to allow rest and relaxation. Nitrous oxide, given at any time in your labor, is administered by only you, the patient, can be used during your contractions through a mask, and then after the contraction, the mask can be taken off. And an epidural, which is a pain medication that goes in your spine. The team will go over the details while they are placing the epidural. It will make your legs numb, so you will be confined to the bed. The bed does move in different ways, so you will be able to change positions. You just can't stand with that in place and will need continuous monitoring. A common question with epidural placements is when would be the best time to get one placed. We encourage women to labor as long as they can without epidural, but everyone is very different in what they need and what they tolerate. As long as you're able to sit still, you can get one. Nurses and providers will suggest coping tools for you. These include using birth balls or peanut balls to keep moving, walking around, getting in the shower or tub, position changes, massages, distractions, or heat and cold. We have gone over a lot of information in this video. Please do not hesitate to call your provider with any questions or concerns.